recognize that how stressed the system is and how stressed the physicians and nurses are. And this little bit of reprieve, even though it's small, goes a long way to helping the morale of the teams that are working so hard on the front lines in Toronto. And I'm sure this team is going to do the same in Brampton. So we're very proud of the team. We're very proud that they stepped up. And this is welcome help to our Canadian neighbors. No, our position has been the same from the very beginning. All the provinces made their plans with respect to the vaccines based on a per capita model, and so we're still sticking with that right now.
Do you think that plan could change perhaps because of given regulations from the other body that you were I guess you still are a member right now.
I'm still a member of the CMA, proud still member of the CMA, but no, we're sticking with our model and how we've looked at this from the very beginning is a per capita basis of distribution from the federal government. We have to make plans for that. There's a distribution network that has to occur here within the province. We need to make sure that we're looking after our citizens and we're doing what we can to help by sending medical professionals to other jurisdictions. I understand the position of the CMA, but we are, and frankly, aligned with all the other premiers across the country and the Prime Minister right now, that that's the position that we're taking.
But do you think that it's the most effective way that you can help us sending
Yeah, as I've said before, I believe right now that Ontario has a forest fire. We're sending firefighters. They don't need a fire prevention unit because there's an active fire burning. So we're sending firefighters. The vaccines are fire prevention, and we're using that to prevent a fire from outbreaking here, and I think that's the most prudent and responsible thing to do with our vaccine allocation.
How much support do you have right now after a lot of the crew that's already gone, and then a lot of these members are some of your closest friends and
Yeah.
those that you work with in North America?
Pardon me, how did you say?
How much FOMO do you have?
Oh, I have a tremendous amount of FOMO. It feels weird to see Allison go and then to see Art and Michelle go and not have red bags packed and be a part of the team. It's been a harder adjustment for me leaving the medical profession or leaving it to the side than I ever would have thought. And seeing the empathy and care that these Newfoundlanders and Labradorians are providing elsewhere, it touches on my heartstrings and makes me have a tremendous amount of fear of missing out, if you will.
There are a lot of Newfoundlanders and Labradorians who are in communities where they may be missing nurses, for example.
Absolutely.
Of the coast of Labrador, the nursing positions are vacant. What do you say to them who they see nurses leaving the province saying, hey, we have extra to spare, and they say, hold on, my community doesn't have enough?
Yeah, and as I've said from the beginning, that's a false equivalent. Like we're not really comparing apples to apples there. This is an acute crisis need. We've been working with the Nurses Union to address through different models. Had a great call with Yvette the other day about how we can look at nursing and frankly physician supply in some of these rural and remote communities. But right now this is an acute crisis that's facing Canada, and I'm very proud that Newfoundlanders and Labradorians have stepped up. So it's not the same. Of course there's similarities, and that's the logical fallacy involved in false equivalency, but they're similar, but it's not the same scale, it's not the same demand right now. And I don't subscribe to the fact that you have to do one and not the other. If there's a global crisis, just because Canada is not in a good financial or fiscal position, should we not be obliged to help elsewhere? I think that we need to make sure that we're managing both at the same time. We've committed to working with the Nurses Union. Had a great call with her the other day about other models of providing care, like fly-in models that they use elsewhere in Canada and the territories, and maybe that's the solution. But we're working hard with them for the medium and long-term solutions that those communities need and deserve.
We're seeing wildfires now in other parts of the country, Ontario being the primary one. Are you concerned about the numbers we're beginning to see here in Newfoundland and Labrador?
Right now, obviously myself and Dr. Fitzgerald talk every morning. We're looking closely at the numbers and following them very closely. We follow the epidemiology here, the percent positivity testing here, and we're still, despite the uptick in the numbers, which is somewhat weighted in the boat offshore, as we know, we're still doing fairly well here compared to the rest of the country. As I've said from the beginning, and I was very adamant with the Prime Minister and Minister LeBlanc, should the situation change here in Newfoundland and Labrador, we'd be pulling all these people back right away. And they understand that and have suggested that they would provide the equivalent resources to get these people home immediately should it be required.
In speaking with Dr. Ferry in Ontario, what are some of the stories you're hearing? Is it what was anticipated, or is it much worse?
She's said that it's been portrayed very accurately. So it's not been exaggerated for flair, if you will, or theatrics. it's been portrayed very accurately. She's working very hard, long days, and it's been very welcomed and needed. They're really stressed and pushed to their maximum. These teams are working together very closely, and that's how we would work here. I think one of the encouraging things actually that she's kind of conveyed to me when I was volunteering on the COVID unit here, it's set up the same. We had to recognize that there's only a handful of critical care physicians across the country. There's only a handful of respirologists across the country. So, you have to put medical teams together of nurses and other physician specialists together to run these COVID units. And so that's why, you don't have to be an ICU doc to contribute. And she's had, I don't want to betray any patient confidence or even trip into that area, but some of the stories that she's been telling or conveying to me without relaying any patient information has certainly been, it's been sad and tough on her, and heartwarming to know that she's there providing help and assistance to the patients and the families in need.
So that team paired up individually with other workers in Ontario. This team, they're sticking together?
My understanding is there's a bit of both going on in Brampton. They're going as a unit to Brampton, but they'll probably be deployed a bit separately throughout the hospital system. We need to go where this is not our request, right? We're answering our request from Ontario, and we'll fill in the positions that they need. They do a needs assessment, and we try to fill those needs. Peter?
Newfoundland and Labrador are so far the only province that has sent medical assistance to any other province. Do you hope that this kind of gives a little nudge to other provinces as a bit of encouragement that if we can do it, they can do it well?
That's what I said on the First Minister's call the other Thursday evening past. There was a great deal of gratitude from Premier Ford on that call, and from the Prime Minister, and the Minister Freeland, the Deputy Prime Minister, was on the call as well. They were very thankful for Newfoundland and stepping up, and I said if there's any, if we can spurn on some other people to help in this time of need, certainly that would be welcomed, and people should evaluate where they are, and if they can, it's within their capacity. It's always within your own capacity, so I'd never pretend to speak on other premiers' behalf, but recognizing your own capacity limits, if you can help, you should help. And frankly, Newfoundland and Labrador has also shown strong leadership and action despite external pressures of elections and everything else, as we all know, in taking definitive, strong public health measures, and we've shown that can work. And I think that should be a model that others across the country also look for when trying to grapple how to get these numbers under control and back to normal.
Premier Ferry, how many medical professionals have stepped forward to go on these trips?
I think the last time I looked, there was about 40, a list of about 40. So there's been a lot of people put their hand up, and look, we wouldn't expect anything else from Newfoundland and Labrador. When there's a time of need, a time of crisis, Newfoundlanders and Labradorians have historically and for generations been the first to answer the call. And so I'm not surprised at the number, despite the challenges of capacity within our own healthcare system here.
And how do you choose who goes, and will more be going after this?
In terms of choosing who goes, that's kind of been a combination between the two departments of health, between Ontario and Newfoundland and Labrador, and looking at their needs assessment and looking what the system here can accommodate. So I hate to use Allison as an example, but she's part-time, and so her shifts are a little bit more shiftable and absorbable within the system. So consequently, that's someone who's a bit more disposable, if you will, to some other jurisdiction. So it's a combination of needs and flexibility, needs from Ontario's side and flexibility within our own system, and trying to marry the two as the best of our abilities.
Okay, last question to Sarah.
Oh, sorry, and to speak, we're not sure yet. To answer your question, I really have a great deal of hope that the vaccines are going to start to win within the next couple of weeks, and you're going to see an even greater impact of the vaccines, especially in Southern Ontario. We're looking at 35% of the Canadian population with one dose. We're seeing good evidence that one dose is effective at not getting rid of COVID altogether, but eliminating hospitalization, severe disease, critical care occupancy. So I'm really hopeful that as the vaccine program ramps up, and we're expecting 2 million doses this week, et cetera, that this will really take hold, and the vaccines will win over the variants despite these hotspots.
Have you had direct discussions with the board about rerouting vaccines from the province to this province?
No, he's never asked, to be fair to him. But we have talked about it in generalities on in the Premier's call, in the Atlantic Premier's call. And Premier Ford has been incredibly grateful for whatever help we could offer, and he recognizes the limited supply of vaccines. But he's been nothing but grateful and supportive of Team Newfoundland's effort to help Team Ontario and ultimately Team Canada.
Okay, thank you folks for present at this time. Dr. Rideout.
Good morning. I'm Art Rideout. I'm a reconstructive surgeon here at Eastern Health. I want to thank everybody. The Premier, it's different not being able to bring him along on a mission, but I'm very thankful to be here, very proud to be doing it. It's a good thing, trying to support others. I think it's something that the RHAs, the provinces, every level, all the people here making this happen, I'm just proud to be part of it. So we've been assigned to Brampton Civic Hospital to provide supportive care in their COVID unit. And that's something that Eastern Health would have asked me and other surgeons to do. So providing supportive care to a group that hasn't had a break for a long time, I think it means a lot.
This isn't your first time going into medical related situations. How do you compare this to some of the other trips you've done?
So
This isn't your first time going into medical related situations. How do you compare this to some of the other trips you've done?
So the theme is the same. It's somebody needs help, and if I can do a little bit to help them along the way, well, that's the way I was raised. So to being able to help somebody anywhere is a good thing, and if we can do it in our own country, I think that's a special thing.
What are you hearing from your colleagues on Ontario?
So it's dire. Their numbers and volume is much more. Their capacity is being stretched. We all know there's people being transferred because of ICU care and need, so that just speaks to the volume and the dire situation that they're dealing with.
How are you feeling as you head up this morning?
I'm nervous. You know, this is a new one. This is I'm always nervous in front of the mic, but I'm excited and I can't wait to get there. I just want to be part of it. I want to help. So, yeah.
What did you tell your family about this?
So they're always very supportive. They're very proud, and I think they'd be disappointed if I didn't step up. At the same time, it's something we do, to give back. Something, like I said, I was raised with. I got to say, Happy Mother's Day to my mom, Rosalita Rideout. I got to do that. And to all the moms, Mary and all the others that may be away from their loved ones during COVID. So, Happy Mother's Day. I think it's a way. I don't think it's a competition. I think, if you lend a hand to a neighbor, I think that's what we all do. That's, again, how we were raised. So, if you can, you should. So, I take that attitude too.
Anything else you want to add?
No, I did the Mother's Day. That's good. Thank you so much. I appreciate it.
Dr. Rideout,
Thank you.
Okay, so I'm Michelle Murphy. I'm a nurse here in Eastern Health, and I'm presently working in the day surgery program.
Have you spelled your first name and last name?
MICHELLEMURPHY.
How do you feel about going?
I have a lot of emotions. I'm nervous. I really don't know what we're facing. I'm excited. I'm, honored to be able to give back in my own country. I've traveled a lot with Team Broken Earth. It's kind of strange being here today, and the Premier's on the other side of the fence. He would normally be the one leading us all now and get aboard that plane. But I'm excited. It's a good thing. I think it's great that we can do this, and I never dreamed I'd have the opportunity to give back here in my own country.
How do
So
you
it's good.
mentally prepare for something like this?
You don't really. I don't know. I haven't really thought about it much. I mean, it was quick happening. I found out Thursday, and here we are. It's Tuesday. So I had, a lot of emotions and sometimes a bit of panic. Can I do this? What am I facing? How's it going to be? But I think I have the personality for it, and I think I'll be fine.
Why
Yeah.
do it? Why are you doing it?
Because the opportunity to give back. I've been to Third World, I've given back there, I love it. Nursing is my passion, I love being able to help people, and today I'm going to give back right here in my country.
Do you think?
As a healthcare worker, what do you think about the debate surrounding this whole enterprise where, people in other regions are saying, well, we could use healthcare out, people in our, for example?
I don't think there's really any comparison. We're in the middle of a pandemic, and Ontario is facing some really tough times. And the stories coming out of Ontario is they're exhausted. We're not. We're exhausted in maybe some different areas, but nobody's suffering here. There's no comparison between here and Ontario right now.
What are you hearing from your colleagues up there?
That it's busy. The staff there are exhausted, and they've been welcomed with open arms, and they're looking forward to us coming. And you know what, if I can go there and I can give a nurse an extra 5 minutes on her coffee break, or I can hold the hand of somebody, or I can wipe the tear of somebody, then I'm helping.
What's your experience treating COVID here in Newfoundland and Labrador?
I don't really have a lot of experience because we've not really had much COVID here. But I have the knowledge, and I feel like I can do it. I'll adjust.
Anything else you want to add?
No.
What do your boys say about it, though?
Well, I sat them all down and I said, guys, Ontario's called for help, and I need all of your honest opinion how you feel about me going. And their immediate response was, you're not asking us, Mom, you're telling us you're going. And that was true. And that was it from there. And no, they're very proud. There was no hesitation. This morning on deck, they were, good luck, Mom, we're proud of you, take care of yourself, just be safe. Yeah. Pardon me?
Did you say your boys have 2 sons?
3.
3. How old are
They are 20, 16, and 15. Yep.
Do you know how long you're going for?
I'm going for 14 days. Yeah.
Okay, thanks guys. I'm gonna turn this down real quick to do a group photo, and then they need to get briefed to get on the plane, but you can hang out and get the shots right here.
Thank you.
Thank you.
Okay, thank you.
I came to Gander in 1959 with my husband, who came to teach Latin, believe it or not, in the high school. And I came to teach grade 6. I spent half my life on the farm, which is a place called Wallcove, which is halfway between Morton's Harbour and Tizard's Harbour. It didn't give us any amount of money, and I mean cash. We had a good living. Like, we had cows and pigs and a couple of horses. One horse was used for work, the other two were ponies that belonged to my brother and I. There was little money to be had. It sort of came through osmosis. I saw it, all the time. My mother working in the garden, my father, he learnt, and my mother learnt from my grandfather how they planted the potatoes. So they would keep the seed, and when they would dig them in the fall, the potatoes, they'd be sorted. And the nicest little potatoes that would be about that size, with nice shapes and a number of eyes, need one of the potatoes. So about this size, they would keep them, or a little smaller, but not too small, not like half of that. Make sure it's solid, not soft, because they would, or wrinkled, like this fellow's skin, because he's old, he's over, this one is past his time. And you look at them. And of course, as time went on, and a number of times you did this, you knew, you could look at them. And my grandfather would look down without a glass, and without any glasses, he could see how many eyes. So these indentations that you see here are eyes. And you need, the rule is you need at least two. At least two. Because one may not, but I sometimes look for 3 or 4. And they will sprout new. This is what they will sprout, and that's a different coloured potato. So these will be kept, faithfully kept, in a root cellar, and carefully looked after that the rats didn't eat them, because that was their food for next year. Now, there's an area of thought today, and I've been told this, that you don't do it, because it weakens the stock. Well, I am using the same seed out there in my little potato patch, the same seed that I brought with me to Gander in 1964. So, personally, from my personal experience, it does not weaken the seed. This is my potato that I'm going to plant, and you can see that, as I talked about before, we have 3 eyes. 1, 2, 3. So now I'm going to cut it in 2, and I'll make 2 seeds from this plant. But, just to be on the safe side, I'm not going to plant that one, because why? It only has 1. So, I would dig my trusty hole in the ground about 3 to 4 inches deep, and some fertilizer. You could use commercial fertilizer, or you could use manure or kelp. So you plant it in, eyes up, cover them up, and leave them be. 3 weeks later, you will see those little eyes come through the ground. And that'll be your potato for next year. This one goes into your compost to be recycled into soil. And they can almost grow anywhere. I have a compost in which my scraps, potato scraps, will go in, the peelings will go into it. And I've actually seen potatoes growing in my compost. They're actually growing with stalks that high, just from a potato peeling. So they're pretty resilient. When I started to do seriously, it was 1979. We bought a house in Eastport, and it had a half-acre of land with it. And I love to garden, I must say. I love to grow flowers, and I love to see things grow. My husband made a bin in which he insulated it and lined it with cardboard, and that's where I keep my potatoes. And when it gets really, really cold out, I have a light bulb, and a 60-watt light bulb will keep it just at the temperature, because they need to be kept at just below freezing. Otherwise, they become seed too early, and you don't want them to become seed until at least May, because you can't plant in Newfoundland till June. If you've got a back lawn, dig up a small square, like 24 by 24. That's inches. I don't deal in centimeters before my time. And try potatoes because they're easy to grow. You'll have to buy your seed because you don't have the advantage of that. Or maybe you might find some old biddy like me who will give you their seed, that they had. And try it and see what you think of them. And start there and see if you like, number one, what comes out of it. If you get some pleasure out of doing it, and it also provides you with a lot of exercise. That would be my tip to younger people starting. And I think we're on a very slippery slope here of processed food. We've got the highest rates of diabetes of any province in Canada. We've got the highest rates of obesity, and we're killing ourselves. So I really think that's a message that even if you did it on a little scale, it takes a bit of elbow grease, and it takes exercise. But if you enjoy it, not everybody will enjoy it, but there'll be some. And I think the quicker the better.